In February of 2014, I noticed a growth on my left arm, and it was about a little bit smaller than the size of a golf ball. And so I went to my doctor. He referred me to get a biopsy. So I went and got the biopsy, and they told me that I was diagnosed with synovial sarcoma. At first, I was speechless. I didn't quite know how to process it. Of course, my mom was there, and my dad. They were both there. And when we heard the news, you could hear a pin drop.
We didn't know what to think. So my husband and I, we came home immediately and started searching the internet. And the things that we found were very frightening because everything we read was negative. It just didn't give us any kind of hope.
And we had no clue what the outcome might be. We had to rely on, the expertise of the doctors.
The treatment for this is often a combination of various modalities that we have to offer. We have a lot of these available locally within Wellstar. I discussed with her that this would require the expertise of a medical oncologist, a radiation oncologist, and a surgeon, following which she underwent radiation therapy and surgery for resection, and then following which she underwent physical therapy and rehabilitation for complete functional recovery.
Things turned out great. I have minimal scarring, and I'm actually able to use my arm a lot more than I thought I would be able to. It's a lot stronger than I thought it would be initially. I'm still working on it, still, trying to do physical therapy and weight training and just working on my range of motion. But honestly, I couldn't be happier with the results. All the nurses were very helpful, very welcoming. Every time I came to the office, I felt like I was with the same nurse, even if I did have, one or two different nurses working with me. They always introduced themselves and very understanding, and because they understand that you're going through some tough times when you're dealing with cancer treatment. So I always felt welcome, and I feel like they understood